So what is keratoconus? Keratoconus is a common disease around the world. It's found primarily in hot countries, and it has a very strong association with ocular allergy. In medicine, the easiest way to understand what we're talking about is to define the terminology. So if we look at the word keratoconus, kerato comes from the actual name from the cornea, and conus means a cone. And what's happening is the cornea, which is this clear, what I refer to as the windscreen of the eye. So it's the front part of the eye, which also happens to be the strongest lens of the eye. The power of the lens of the cornea is double the power of the actual lens behind it inside the eye. And when that lens goes out of shape, we call it keratoconus, and the lens actually, or the cornea, becomes the shape of a cone. The way that happens is when people have ocular allergy, they tend to rub their eyes. And with rubbing, you push the cornea or milk it out of shape. We initially call that misshaping astigmatism. Astigmatism means not a point. So the way we see that initially is just small amounts of misshaping of the cornea. But as time progresses, with more rubbing, the cornea gets milked out into an actual cone. So initially, astigmatism in smaller amounts can be corrected quite effectively with spectacles. But as it becomes worse, one requires a contact lens to correct the vision. And eventually, when full established keratoconus is the case, one would then possibly need a corneal transplant. So it doesn't mean that all people who have astigmatism are going to progress to have keratoconus, but it's very important that we are aware of progressive astigmatism and people with significant ocular allergy and significant eye rubbing that tend to milk the cornea out or massage it out into this cone. So how do we prevent keratoconus? Firstly, we must be aware of ocular allergy. Ocular allergy occurs in 20 to 25% of the population. The trouble is that as we're growing up and we experience itchiness of the eye, rubbing the eye actually provides some temporary relief. So the first thing we need to do is identify those people and encourage them to use an eye drop which relieves the itch. And then obviously the other modalities that we use to address ocular allergy apply, and those would be things like avoiding down and feather pillows and duvets and so on, and strong chemicals and various other allergens that drive the allergy. But it's very difficult to not be exposed to things that make your eye itchy. So the important thing is that if you have ocular allergy, don't rub your eyes, and make sure that you consult an eye professional who can give you an appropriate drop. From there, what we want to do is prevent the cornea from misshaping to the point that you'd require a corneal transplant. And the way we do that is the most effective way is to perform a procedure called corneal cross-linking. What the corneal cross-linking does is it links the fibers or the collagen fibers in the cornea to each other, thereby making the cornea stronger and less liable to move into an abnormal shape. Now, we wouldn't perform this procedure on everybody. We would assess the person who has a visual problem with a very particular scan that measures the shape of the cornea and the thickness. And if we saw it progressing, we would discuss those treatments. But just to make you aware that those are the standard treatments for keratoconus and the way in which the disease occurs and progresses. Now, knowledge and understanding of how that happens is fundamental to the treatment, because compliance or the regularity with which a person uses the anti-allergy eye drops is fundamental to the treatment of keratoconus.